So you've probably heard the AstraZeneca vaccine is now available to anyone in Ontario who is over 40 years old, decreasing the previous age limit from 55. I think now is a good time to review the AstraZeneca vaccine and what we know about it so far, namely its safety and efficacy. As mentioned in an earlier video, this vaccine rollout in Europe was previously paused, then subsequently restarted because of a specific type of blood clot mediated through an immune reaction of the body. These will occur 4 to 20 days after the vaccine and are called vaccine-induced prothrombotic immune thrombocytopenia. They're incredibly rare and are estimated to be anywhere from 1 to 4 per million vaccinations. You may have also been aware of the limitation to only those above 55 years old on the vaccine in Canada. This was not a recommendation by Health Canada, rather the National Advisory Committee on Immunization. For as long as the vaccine has been available, Health Canada has recommended it for anyone over 18 years old and considered it safe. Well, what about those with a history of blood clots? Are these events more likely to happen in people predisposed to thrombosis? Right now, there's no reason to believe that a previous history of blood clots confers an increased risk with this vaccine. This is primarily due to the mechanism of these blood clots. The blood clots occur through an immune activation against the vaccine itself. This is completely different from normal risk factors, such as flow stasis, think blood clot in a leg after sitting on a 10-hour flight, endothelial damage, think ruptured plaque in the arteries supplying the heart, and hypercoagulability, think individuals with certain mutations that predispose them to blood clots, such as antiphospholipid syndrome. Because of the mechanism of action of these blood clots is different, those who have a history of blood clots, a family history of blood clots, history of low platelets, or are pregnant are not at a higher risk of developing these blood clots and are not prevented from getting the vaccine. In addition to the fact that the symptoms are incredibly rare, physicians all over Ontario have been educated on recognizing and treating these blood clots as soon as possible. Next comes efficacy. There is a concern that this vaccine isn't as effective as the Pfizer or Moderna vaccines. We don't actually have data comparing them. The data on each of these vaccines is from separate studies with different baseline populations, and the vaccine efficacy has never been compared head-to-head, so that makes it difficult to come to conclusions about how they compare. Finally, it's worth noting that although the AstraZeneca vaccine had a lower efficacy percentage in its study, the general population it was tested in was at a much higher risk to get COVID. This is why in terms of absolute risk reduction, its numbers were better than the other vaccines. I'll include a link below which delves into the differences between relative risk reduction, which is how the percentages are reported, and absolute risk reduction for those interested in more stats. But for now, the important part to recognize is that this is a highly effective vaccine, and like Pfizer and Moderna, was 100% effective at preventing severe disease and hospitalizations. That's all to say, if you have a chance to get the vaccine, don't hesitate. Your chances of getting COVID decrease significantly, and so do your chances of passing it on to those you care about. If you have any questions about the vaccine, please don't hesitate to ask your doctor.